Hello, so this is a quick video on feminine hygiene 101. When I was a teen in sex ed class, they never taught us about feminine hygiene or douching. I was unfamiliar with terms like pH balance, yeast infection, and how to properly take care of, my lady parts. What was even scarier was that I couldn't turn to my mother for this help because she would have lost her mind. So it wasn't until I was 18 that I started learning about how to properly take care down there, and I'd like to share with you guys. So odor/discharge. It is common if down there smells or you see discharge once you start puberty. But you gotta understand that your vagina is self-cleaning, meaning you don't want to mess with down there and throw off your pH balance by putting so much hygiene products down there. It may even cause a yeast infection. What does discharge mean? It is a part of female reproductive cycle, increases closer to ovulation and sexual arousal. Everyone has their own smell down there, and it will continue even after your cycle. The colors and what it means. White. Thick white discharge is common at the beginning and end of your cycle. Normal white discharge is not accompanied by itching. If itching is present, thick white discharge can indicate a yeast infection. Clear and stretchy. This is fertile mucus and means you're ovulating. Clear and watery. This occurs at different times of your cycle and can be particularly heavy after exercising. Yellow or green may indicate an infection, especially if thick or clumpy like cottage cheese or has a foul odor. Spotting blood/brown discharge may happen right after periods and is just cleaning out your vagina. Old blood looks brown. This may occur when you were ovulating or mid-cycle. Sex can also even affect your odor. Douching and feminine washes. Douching just means washing or soaking the vagina. A lot of doctors recommend not doing it for several purposes, but some women douche and some don't. Whether you douche or not, always remember that the vagina is self-cleaning. If you do douche, it is not something you should do every day. It may cause a yeast infection or throw off the flow of the vagina. Some people use water, Dove bar soaps, Dr. Bronner's, or even name brand feminine washes. Feminine washes are used to clean the vulva, not your vagina. For best results, use a washcloth while washing with a feminine wash, depending on your skin or vagina. Use scented or unscented wash. Sensitive skin or no sensitive skin cleansing cloth while on the go. Hygiene routine doesn't only consist of your vagina, but your body as well. Use a body wash for your body of choice. Soaps, loofahs, toothbrushes, floss, Listerine, body wash, cream, body scrubs if you want, perfumes. Foods contribute to your odor. If you want to know the real determinant factor that controls the smell of your vagina, it's what you eat. Eating fruits and greens helps the vagina smell great, especially pineapples and almonds. Having a well-balanced diet and exercising, while not overwashing the vagina, will help down their smell great. Everyone has a smell, some stronger than others, and occasionally it's okay if down there don't smell fresh. So here's a list of foods and other things that defeat bad odor. So you have eating fruits like pineapples, nuts like almonds, greens, especially kale, Greek yogurt, citrus, cranberry juice, which can also clean out the systems, fight UTH discharge, and many more. Lemonade helps restore your pH balance. Garlic, but not too much, can help fight vaginal problems. not wearing tight clothes or pants, drinking water, well-balanced diet, not using too much products down there. Shaving is optional. This is the last thing talking about yeast infections and sex. A yeast infection of the vagina and tissue at the opening of the vagina. Symptoms include itching, burning, discharge, painful urination. There are no real cause of yeast infection from sex, douching, or so many other things can cause a yeast infection. Even wearing tight pants can cause a yeast infection. Treatment involves topical or oral antifungal medications. Yeast infections are very common and affect up to 75% of women at some point in their lifetime. Keeping the vaginal area dry and avoiding irritating chemicals can help prevent yeast infections in women. Consuming foods with probiotics also may help. It can occur if you're sexually or not sexually active. Guys get most commonly through sexual intercourse. Douching with too much scented things may increase the risk of yeast infection. Using dirty undies can increase this. A smelly vagina and bumps, HIV, and hormones. So that's it. Just a quick video, but thank you for listening.